Not reproductive and urinary. So usually when they refer to a urologist, that's usually for male urinary tract. Women, they have their own specialty. All right, so the first one, obstetrics, that's when you're pregnant. And then gynecology is just a women's specialist. A lot of physicians are actually both. So there'll be both an OBG and a Y. Urology then, of course, is usually referred to as male. Medical assistant's role, so similar to assisting in any exam, we're just going to stick specifically to reproductive and urology. All right, menstruation. So that's the first step, usually mark of puberty, menarche, your first time. And then the bleeding usually lasts anywhere from 3 to 7 days. Menopause. Now, if a woman elects to have her uterus ovaries removed, she's going to have menopause 2 times. That's because you get the physical menopause and then the chronological menopause as well. So they'll have it twice. So that's part of the patient education in their informed consent. Before, peri is around. So this is going to be before and after. And you know the slight changes. So 35 plus years is usually when the onset. So irregular menstruation or skipping menstruation altogether. So the purpose of the gynecological exam, women's health. Cancer screening, so that is your preventative care. So your pelvic and pap smear, P and P. We mentioned last time for assisting in exams, so make sure there's a female assistant in there at all times if it is a male doctor. Just have the patient be comfortable. Hello. And determine LMP, last menstrual period. Then the doctor will come in after you do your MA duties, so vital signs, your initial overview and documentation of their chief complaint. And then the doctor will come in, do the total health evaluation, and then the systems as well. What's an STD? So you can't get a disease sexually, but you can get an infection, right? So they changed the name. So it shouldn't be STDs anymore, STIs. So that's why you see it. So that means you're swapping microbes and viruses. Breast exams. Okay, ladies, we mentioned this last time. How often should you do a self? Every month, right? 3 things. Hand to the side, right? Arm to the side, arm to the back. And then the third thing is the contour, right? The contour of the breast. So what happens with cancers, remember it pulls. So if you start to see like it pull in because there's the cancer and it's pulling in the tissue, then that's no longer the correct contour. So imaging of the breasts. So they're going to squeeze the breast between 2 plates, so horizontally, and then also vertically as well. So keep the patient comfortable, drape them, and of course, appeal to their modesty, dignity. Family history. Angelina Jolie. She had the gene. Not only did she have the genes, but her family members expressed the genes. So that's the epigenetics. So everyone, we all have cancer genes, but they're not turned on. So what causes them to turn on is the epigenetics. So in her family, those genes got turned on. So she said, forget it. I'll remove the breast. I'll remove the uterus as well. Speculum. You may want to warm the speculum for the examination. Palpation. Bi. How many is bi? Two. So the doctor will insert digits in the vagina and then palpate the abdomen. Or insert the digits into the rectum and palpate the abdomen to feel the structures in between. Right. So digits here, then fingers here. So they're feeling the structures all in between. So that's what they mean by bi-med, two hands. Pap smear, we're going to scrape some cells from the cervix, the opening to the uterus. Take a look at it under a microscope. And this is potassium hydroxide. And that helps fix the cells onto the slide and preserve them so they don't change before we have a chance to look at them. Wet mount's simple. You guys done that in lab yet? You just put cells on the slide. You might add a drop of normal saline and then, yeah. Usually normal saline so the cells don't damage. And then you put your cover slip over. So this is the quickest, easiest method to view. But if you need to fix them and stain them, you want to make sure they don't change before you get a chance to stain them. So you got to fix them first. As mentioned, the system. Drape them, dignity, and then have the instruments available. So you guys are females, all mothers. So we'll just go over this quickly so we can focus on the CPR items. Estimating. So how many months are you pregnant? 10. Yeah, very good. So you're a true mother. So they say 9, but it's 40 weeks, which is more like 10. But it's easier to split 9 into 3, 3, 3 for trimesters, right? So don't fool yourself. It's actually closer to 10 months. So that's why you subtract 3 months and then add 7 days. I think we do like maybe one of those calculations in the course. So it's not too bad. Exercise. My sister walked a half of a half. So 26.2 is a marathon. Half is 13.1. What's half of a half? 6. She hate math. So she walked 6.5 miles, which is perfectly fine. I think it was her second trimester. Birthing class, know what to expect. That's the most important thing. Because if you don't know, you're gonna freak out at everything. So mostly everything is normal. So you can focus on things that are abnormal and get help then. Why do you get morning sickness? You got this parasite inside you, and your body's like, get rid of it, throw it up. No. So, yeah, a lot of hormonal changes, and you become more sensitive to certain chemicals. So, it's kind of the body's way of rejecting any bad stuff you may have ingested. So, make sure you know which remedies you can take, because there was a big problem that caused birth defects. What did they say average weight gain should be for you guys?
20 pounds.
20 pounds total?
Yeah.
Okay, not bad. Really? Just 20 pounds? Because the kid is what, about 8? And then the rest is placenta and extra weight. Okay, not too bad. So anything more than that, you're just going to have to lose after the baby, right? Depression, hormonal changes, estrogen drops. So that's one thing. Adequate estrogen keeps an elevated mood. Constipation, guess what? Your stomach is pushed up. Your intestines and bladder is all pushed down to make room for the baby. So that means stomach gets smaller, intestines get smaller, and hopefully they very important for your appointments. So in the first trimester, how often? Yeah, it's like 1 or so months. and then it's every
Like a couple of weeks.
2 weeks, and then it's every
Week. Yeah.
every week until time to go, right? So that's because they want to make sure everything's going okay, and if there's a problem, they can plan for it easier. Did you guys do 3D for your aliens?
I didn't.
No.
I
Yeah.
wish.
Oh no, it depends on where you go. Now, when it first came out, it was like
That's why I
very
neglect.
pixelated.
I was like, I'll just wait.
Now it's almost like real, virtual reality real. Pretty scary. See your alien baby. All right, let's see. They'll check everything to make sure it's okay. Anything out of spec, signs of injury to you or the child. Oh, prenatals.
Mm-hmm.
These are like the best vitamins you can get. Even after, keep on taking them because you guys notice your skin was glowing, your hair was awesome, your nails were super strong. So just keep on asking for them. They're awesome. Gestational diabetes usually goes away after pregnancy, but it can cause damage to you, the mother, and the baby. So in the third trimester, they want to check and make sure that the kid doesn't get too big, because then you'll get problems. Because if they have diabetes, uncontrolled sugar in the mother, which is then uncontrolled sugar in the child. When to go to the hospital? Every 10 minutes, right? So if the water breaks, you should go, but contractions every 10 minutes and it should last. Schedule. Did you guys have your scheduled or induced?
I had mine induced too. My first one and my second one, she just
Came out, no labor. Yeah. They say the first one is usually the longest labor.
13 hours.
26 hours and 38 minutes.
13, 26 hours. So to your 4-year-old, you say, I can never get those 26 hours back. Cesarean sections now aren't so bad. They used to make a large incision. Now it's just a smaller incision in the bikini line and not too big of a problem. Now the only time they'll cut a larger incision is if the mother is HIV positive. So the fetus inside the mother is HIV negative. The placenta does not allow it to enter, but we're going to have to cut a huge hole so the child does not get exposed on his way out.
So if a mother has HIV, they just take the whole placenta out?
Well, the placenta doesn't matter. It's the child. We don't want the child exposed to blood and bodily fluids. That's how HIV will be contracted to the child, not through the placenta.
They'll always do a cesarean if
Yeah.
someone has HIV.
Yeah.
Oh, okay.
Yeah.
And then you said it won't come to the baby. Like the baby won't be born with HIV.
Yeah, the baby is not born with HIV. They're only exposed during the taking it out. There's blood and fluids. So what they do is they clean the baby and they start them on HIV meds right away. If we know about it, we can plan for it. So if the mother doesn't tell us she's HIV positive or we never tested, then the baby has a high chance of contracting it during natural childbirth.
What about the people delivering?
Oh, you have your PPE, so you should be protected regardless HIV positive or not.
Oh, okay.
Yeah, that's just standard precaution. Who gets the cut?
The dad.
No, I'm doing the old tradition. All the men are at a bar down the street. All the ladies are at the hospital. When the kid comes out, send us the snapshots. We'll be drunk because that's the last time the father will have freedom, right? So let him have his second bachelor party.
Sometimes the doctor cuts.
Yeah, but now the tradition is take a picture. Here's dad. I cut you the cord from mom. Now you're a real person or something symbolic like that. So induction. What hormone do they use?
What do they call it? Yeah.
Oxytocin is the generic. Pitocin is the brand name. So that's the same stuff for milk release. When you hear a child cries, Same stuff for sexual orgasm to build bonding. So it's that tricking hormone. Tricks you into forgetting how painful childbirth is, so you want another child. Breastfeeding. Colostrum is the immunity. So usually before childbirth, you'll get colostrum that discharge from the breast, but it's only after childbirth that you'll release full milk. So this is good because it contains antibody. So encourage the mother to breastfeed, even if they want to pump and then give it to the child. And new research has shown that this helps develop the natural bacteria in the child's gut. So they compared children who were breastfeed versus children who weren't, and those who were breastfeed got all the good bacteria in their gut, healthier GI tract and diet.
What happens when, like, say, how some people, they have a kid and they get pregnant right after?
Mm-hmm.
So say when they have their baby, what if they're still breastfeeding? The kid doesn't get colostrum or what?
I have no idea.
I just wondered.
So that is Irish twins, is that what they call it? Or Catholic twins? So that's it. They used to call it that. Like after birth, they'll get pregnant again right away.
Mm-hmm.
So that was the joke, or not what they traditionally call it, and it is true. I have Irish family that are Catholic. Instruct the patient. If there's not enough milk production from the mother, and then of course supplement with formula. And then children, they don't really have good taste, so they can't really taste the difference anyways. Never prop when you bottle feed, because feeding is where you build the bonding. And we'll talk about this in pediatrics. So if you don't respond to your infant's cry right away, they don't build self-esteem because they feel like they're worth nothing.
I started propping at like 3 months.
Oh, yeah. Now look at your 4-year-old. Mom, why is she so sad? She'll never marry the king. Right? So avoid cow's milk. Too high in everything. So a lot of sugar, a lot of salt, and the proteins and fats are too big for your baby to break down. I think maybe goat's milk's a little better. Postpartum. So this is afterwards. Hormonal changes may cause depression. Pregnancy tests. What are we detecting for?
HCG.
What is HCG? What releases it? Of course it's a hormone. Where does it come from? Why does it indicate pregnancy? Right? That's more important. That's the critical part that you hate, right? So human corticotropic hormone. So that is pretty much what's going to start the placenta. So if you have fertilization and implantation, then if a placenta starts, then that's the hormone it kind of releases. So that's what we're detecting. STIs. Bacteria, virus, fungal, and protozoan. So Pseudomonas is usually the main protist that infects. Another example is malaria. Malaria is a protist. Careful, certain STIs can lead to sterility and or insanity. You can go crazy from syphilis.
What?
Yes.
So, wait, what is herpes considered? Because you have it forever, right?
It's a virus.
So
There,
it's still considered STI and not an STD?
it's an infection. You have to pass the virus from person to person. You don't get born with it and develop leukemia or develop virus, right, from your genes or your body. You got it from the environment. So there's hundreds and hundreds of herpes viruses, hundreds and hundreds of HPV viruses. Right? So cold sores, that's a type of herpes. Right? Fever blister, that's a type of. They're all in the same family. What causes warts? Warts are tumors. Papules are tumors. So all of these are virus. They attack DNA, can lead to cancer. Mandatory reporting. So no HIPAA violation. You just have to report it. CDC. CDC. All right, imaging. So X-ray is easy, right? You guys are used to X-ray. So remember, it's a negative because we're using film. So whatever hits the film turns black, right? So if it's white, that means it's dense. That's why when you see an X-ray, bones show up as white because it blocks the X-ray. It doesn't hit the film. So these are other imaging. So we can use sound. So we can use tomography, or we can use magnetic resonance. So it's all different ways of looking in the body. Uterus, tube, imaging. Right? So we're going to image the uterus and the fallopian tubes. Mammograms we already mentioned. How often?
Every year. Every 3 years.
It was supposed to be every year, but they found that self-examinations work better. So now they're kind of doing it like every 2 years. That's why. Every month.
So doing the hyster thing is the same as a sonograph? You just do it lower or what?
Yeah, you're looking for more of the fallopian tube, so you're going to the sides more.
That's pretty cool. You can see that on the screen.
Yeah, all imaging. So just like a sonogram in your baby, they can see your ovaries and everything. I think they have it so well that they can actually see the egg about to blister, the follicle about to rupture off the ovary.
That's cool.
Fetal screening. Risk factor, we already mentioned, increasing age of the mother. Remember, all your eggs you had at birth. You don't make any new ones, so they gather damage, toxins, pollutants, radiation over lifetime.
Is that why the older you are, you have a more chance of your baby being like messed up?
Down syndrome, right? Because the damage to the DNA throughout your lifetime. Do you like tuna? Women aren't supposed to be eating tuna.
Why?
Because of the contaminants. They concentrate heavy metals. So young girls, are you feeding your kid tuna? No, it's popular, so I don't know, down the line, we might have a bunch of mercury contaminated kids. So alpha fetoprotein. So it comes from the fetus, of course, and this is a sign of spina bifida. So spina bifida is when the spinal cord does not completely close. So some of the neural stuff can leak out, and that's what we're detecting. Fetal size, position. So if they're breached right before birth, we have to massage them so they're head down. Puncturing to get some fluid. So the baby is swimming in the amniotic fluid. So some of their cells will flake off as well. So if we want to sample the child's actual DNA, we can suck some of that fluid and hopefully we get some of the placenta, right? Remember HCG? That's where the C comes from. Or we can get some of that fluid to detect the child. You guys heard of the RH factor incompatibility?
Yeah. Isn't that the where they inject you?
Yeah,
Different blood types?
yeah,
I have that.
yeah. You had that with your child, your second child, right?
Both.
Yeah. So, so if we know about it, we can do something. Usually, the first child, there's no problem because the mother's immune system has to take time to reject the fetus. So the first time may or may not have a problem. So they probably did yours just in case. And then the second time, the mother's body goes, "Hey, I know you from the first time," and then usually the second child will be attacked by the mother's immune system. Biopsy, taking samples, many ways to take samples. So we can cut it, scrape it, or use a needle to aspirate some of the tissue. Copal, just another word root for the vagina. So looking into the vagina and cervix. D and C, what's P and P? Pelvic and pap smear. D and C, dilation and cervix. So common abbreviations for the appointment book, so you don't violate HIPAA. Stereostatic. Stereo just means you can see in 3D view. So instead of looking physically, there's a camera and you're looking at the monitor. And a lot of surgery is using robotics, and they do it the same way. Removing the uterus. So you can just remove the uterus itself, or you can remove the uterus and all the other structures, including the fallopian tube and the ovaries. So remember, how often are they going to get menopause?
Twice.
Physically?
Why do people gain weight with hysterectomy?
Hormonal changes. Yeah.
Is there a medication they could get? For example, like if you're younger and you have to get them removed for whatever reason, so is there any medication?
Yeah, hormone replacement therapy. So we have to find the correct levels for you. So initially it's going to be really hard because your body's going to go cold turkey. So we got to give it enough, and it's going to be constantly adjusted. Back in the 1950s, they just said, hey, old women, everyone, you're all on estrogen, because they knew once estrogen levels drop, you get menopause, but they didn't know it has to be custom.
And when you get older, they give you those pills, or do they just
If you need them, if you need them. So normal levels, right? Estrogen is gonna fall. So if it's too low, then yeah, they'll do hormone replacement therapy. Yeah, and that's pharmacy compounding because it has to be so specific. Electrosurgery. So if they see papules or any abnormal areas, they can just cauterize them or freeze them. Right, urology. Mostly they're going to be referring to male reproductive system, but women, male or female urinary system. So similar, just assist, educate, and make sure all the history, changes in urination. What can that signify?
Stones.
Yeah,
Kidney
ooh,
stones.
that's not fun. Stones usually just pain.
what about an infection?
Infection would be pain, and then discharge, right? So urinary changes, if it's benign prostatic hyperplasia, then it's going to be like weak stream because the urethra is being impinged by the enlarged prostate, or there'll be increased UTI, pooling of urine, dysfunctional urea, so painful, abnormal, and then what's incontinence?
Where you can't control.
Yeah, you already went. It's not urge, right? You don't feel like you have to. You already went.
Yeah.
Sometimes that's caused by your bladder contraction because it's smooth muscle, so it's not under your control. Sometimes the bladder will just contract. Palpation, so they'll feel the kidneys and bladder. Everyone point at your kidneys. Let me see if you know where they are.
They're in the back.
They're in the back.
They're back here.
Okay, a little bit higher. Yeah. So a little bit higher. Okay, which one is lower, the right one or the left one?
The right one.
Because of the liver. Very good. Or is that a good guess?
When I do this, my right hand is just lower.
So good guess, 50-50. Better than Vegas odds. Of course, we talked about the external genitalia for males and the cup the testes, turn the head, and cough twice. Why do they do that again?
Yeah.
Hernia. Good.
I'm like, yeah, hemorrhoids.
Hernia.
So what if they have that? They have to go to the doctors and
A hernia, usually an inguinal hernia, if it's small, usually not a problem. It doesn't really cause pain. But once it starts to cause pain, then yeah. And then once it starts to cause digestive issues, because that is your intestines. If it starts to kink, start to back up, things like that, impaction, then yeah, they'll have to take care of
They
it.
would have to
Surgically repair it.
surgery.
Yeah, sew the canal so it's not as open.
And oh, okay, so it's because it's a little bit ruptured, or
Yeah. So normally there's two holes
mm-hmm.
in your abdomen. Normally they're offset like this, and the pressure doesn't really push anything out. But sometimes they'll align, and now the pressure can push out intestines.
Is it the same when babies get there?
In
All
there.
their belly buttons swell up.
Oh yeah. Well, that's any hernia is stuff poking out where they don't belong.
Can it cause anything else if they don't? Well, I mean, you said back up.
No, that's it. That's usually the main problems. There's this guy that golfed that had a hernia, and every time he swung the golf club, his hernia, his intestines would pop out a little bit, and then he just push it back in, and then he walked down to the next hole, and then he swung again a little, because you twist your upper body, and the pressure builds up, changes, and
How do you get that though? By picking up something heavy?
yeah, stress, strain, sometimes dumb luck.
And if they, let's say they get it fixed, is it possible for it to come back?
Yeah, like anything,
Oh
it can
wow,
come back again.
crazy.
Take it easy. So yeah, people who do like those CrossFit, they're gonna wreck their bodies. So for them, they usually blow out their anus.
What?
Yeah,
How do you
because
blow
they
out your
strain so
anus?
much. Yeah. Digital exam of the prostate.
Jesus.
So we mentioned this last time, right? So they're looking for symmetry. So if one side's larger than the other, cancer. And they're looking for texture, the firmness as well. If it's really firm, might be BPH or cancer. Talked about the self-examination, firm pressure between the digits, finger and thumb, and you're looking for the firm lump, just like in breast cancer detection. Document any symptoms, and then same thing. So they mentioned it previously for female, but it's the same for male. Similar techniques. So tomography scan and magnetic resonance. What's pylo? It's kidney. So this is a
Bile.
looking at the
Something like that.
no kidney. This is the kidney. Urine and blood tests. What is creatinine? Creatinine.
Like creatine?
No, not creatine. Creatinine, like your
Like a
complete
protein?
creatinine clearance. You guys heard of that? You done your urology class? Because that's one of the things that you test for in your dipstick test.
Oh
I
yeah, what
haven't
about
taken
it?
that class
Creatine.
yet.
Not creatinine, not creatine. Creatine is different.
Okay.
So creatinine is nitrogen waste.
Complete what?
So creatinine. So just look up complete CCC, and it'll have it for you. Complete creatinine clearance. So all your nitrogen waste has to be filtered through your kidneys. So if you built up creatinine, your kidney's not getting rid of it. So that urine dip test is a quick way to determine how healthy your kidneys are.
What was the last thing again?
Clearance, because we got to get rid of nitrogen waste in our body. So if it builds up, it's not clearing. Infertility, they might look for a semen sample and check for the sperm count. And then for birth control, vasectomy. So they'll just cut. So you have arteries, veins, nerves, and the vas deferens all in the pedicle. So they're not going to cut everything. They're just cutting the vas deferens. They're going to tie a knot in each end, and then they'll cauterize it, stuff it back in the scrotum, stitch you up in. Is it 100% effective?
No.
No.
Well,
Something happens, right? Miracles happened before. So nothing is absolute 100%.
would it be better just to tie it instead of cutting it?
No,
No.
because they cauterize it, so they burn it, so the ends of the tubes are sealed. Right. So if you just tie it, it can unravel. I don't know. They sealed it. They cut it. They sealed it. Who
My
knows?
cousin got a vasectomy through military, and when he got his wife pregnant, got a vasectomy, then she had a baby, and the baby wasn't.
Okay.
Oh
Yeah.
my god.
Well, that's not part of the 100%. That's something else. That's not a controlled study. Yeah.
Baby came out all white. Oh my god. Yeah.
Watch
No
your mouth.
nicks and none of that stuff like
They
that.
did a DNA test?
Mhm.
Cystometry.
Idiots.
Measurement of capacity. So 500 ml should be about the max, but some people stretch the capacity. I think yesterday for 4th of July, some people stretched their urinary capacity.
Yeah, definitely.
Looking into the urine, and then biopsy if need to for cancer. All right, we'll quickly go through the terms. So cancer, any papules, any tumor, any growth might be a sign of cancer, so they'll take a look at it. Ectopic, what does ec mean?
Yeah, outside.
So
Outs.
outside of the uterus.
Mhm.
And if it's in the fallopian tubes, they're not designed to stretch. We're going to have to terminate. Endo, within. Metry, uterus. Condition of. So here the endometriosis should be on the inside of the uterus. But if it's found outside, it grows very, very fast. And anything that grows fast is akin to cancer. So we treat it like cancer. Sometimes they even call it endometriosis cancer. So this tissue can go to the intestines. Is there a lot of blood in your GI tract? And then they'll use that, and then they'll start proliferating cells that shouldn't be there. So they treat it like cancer. Fibroids. So they're tumors in the uterus. Fibrocystic breast changes. It's not a disease. So they change the name. So similar, you have these sacs that might be filled with fluid. Sometimes if they get too filled with fluid, it'll cause pain. Needle, drainage, so it'll always change. So when you're doing your breast examination, these are soft. When you're looking for breast cancer, you want firm pea-sized tumors. Menstrual disturbances. A is without. This is painful, difficult. This is ragia, so that's bursting forth. Metro. Uh-oh. That's even worse. That's your uterus bursting forth. So that's blood. Ovarian cysts, similar to the fibrocystic breast changes. Have you guys heard of toxic shock syndrome?
Mhm.
You're supposed to, yeah? Okay. So when you're educating your teens, tell them make sure you change your feminine hygiene products because the bacteria will produce toxins that can kill you. Premenstrual stress dysphoric disorder. Are you PMSing? So they're similar. That's because you get a drop in estrogen and then you get a boost in male hormones, progesterone. So you literally change every 14 days from female to male. You're in your female, and then you're in your masculine. You're in your feminine, then you're in your masculine.
Every person goes through that?
Every woman, yeah.
Oh,
You ever heard of the menstrual cycle?
what about males?
What?
What about males?
Oh, you're male PMSing?
No, like a male
It.
going through that.
Oh, men don't have menstrual cycles.
Are you sure?
We
Some of them actually.
we have seasonal changes. I think men go through seasonal hormonal changes, and that will reflect their moods, and they will be PMSing like a woman.
Can someone imagine like every day?
It's funny.
Maybe.
Yeah, I would die if a guy said that to me.
No, if a man is not acting right, then there's some insecurities he needs to deal with. So he's usually running away from pain or moving towards pleasure. And usually people run away from pain a lot more. So I don't know who you talk about, but he got problem. Sexual dysfunction. So lack of sex drive or too much, right? Too much libido. For men, ED is a big one. Erectile dysfunction, but there's miracle drugs for that now. Inflammation of the vagina. Here we have inflammation of the epididymis. So urine can back up. It can back all the way back into the testes because the epididymis is right on the testes. So that means this guy was super dirty. Hydrocele, fluid inside the scrotum. And we talked about torsion the other day, right? When the pedicle twists, it can cause circulation, cut off circulation, and then that testes infrocts. That means it dies, and then gotta amputate. No, it'll be painful. I heard it was very, very painful.
How does that even happen?
They're loose. They're loose in the scrotum. So they're just hanging by the pedicle, blood vessels, nerves, and the vas deferens, and they're free to move about. And sometimes, I think skinny jeans, I don't know. And then, so high temperature can also lead to sterility issues. So the skinny jeans might lead to sterility issue or low testosterone production. Right? So no tighty whities, boxers, like in the 90s when boxers were big. We need to bring them back. Continence we already talked about, no longer control it. Stones, so diet, sometimes you'll get from just calcium deposits or protein deposits. Prostatic hypertrophy, BPH, we talked about already. So digital exam for men, something I am not looking forward to because it's supposed to be at about this age plus. I'm getting closer every minute. And ooh, how old? No, I'm just kidding. we can play this. We can play this game.
You're 37?
Plus 10 months. So yeah, I'm almost there. I have a couple years left to do my Kegel exercise, my male Kegel exercises. Inflammation of the prostate. Again, you can get bacteria that just goes to the prostate and cause inflammation there. Cancer, we talked about during the digital exam. They'll check for that. Inflammation of the urethra. So bacteria can back up. STIs. So you're getting some bugs from another person. Virus, bacteria, protozoan. So just be sensitive. Sex is still taboo for a lot of people and a lot of cultures. So just assume everybody's prude. So if you're infected, of course, avoid sexual contact. Sometimes it's hard. Both partners need to be treated. HIV. I got HIV, she got HIV. Do we have to use a condom? Yes, there's different flavors, right? HIV mutates so quickly. My strain of HIV might be different from her strain. And now I got two strong strains in me. None of my drugs work. Yeah.
If we both have HIV, then we obviously don't care.
No. You're on meds. Your HIV is controlled, right? It's like Magic Johnson, right? Just because he have HIV doesn't mean he can just go willy-nilly now, having sex with everybody unprotected, because he can contract a different strain of HIV that his drugs aren't working, right? So you still need to use protection. More you know, right? Now you know. So you guys were born in the 90s. You guys weren't living in the 90s. So you guys didn't grow up with all that HIV education.